Everyone, welcome back to the Screen Society podcast, a podcast that talks all things TV, movies, and everything in between. I'm your host, Logan, and today we're jumping back into the pit. And this was a very intense episode as we're really starting to ramp up to a lot of climactic points throughout the season. We had a huge cliffhanger. We've got some really interesting patients in this episode as we start to get into some really heavy stuff. And just like the pit does all the time, it creates quite some magic and some fireworks, no pun intended, for this episode titled 3 p.m., which aired on March 5th, which was a Thursday, 2026. Director Sean Hattasey, who plays our beloved Dr. Abbott, directed this episode. Writers Cynthia Adarkwa, we had Valerie Chu and Mel Herbert. And this was intense. I mean, we've really gotten into the thick of things with our cyber attack or our pending cyber attack. The pit has gone down because they want to try to secure the firewall. And so chaos has ensued. It left off last episode, the 2 p.m. shift to 3 p.m. It left us off with a little bit of a cliffhanger as Dr. Robby walks out into the lobby and there are nurses buzzing, doctors buzzing, techs, all sorts of different things going on, patients, people coming in and out of the trauma rooms. So we assumed that this was going to get even more hectic, and we're really building up to a episode 10 that I think is going to be the most intense that we've gotten so far. So this was a really good episode leading up to what I think is going to be one of the more pinnacle type of episodes. Obviously, the last two episodes that we got last season were very intense with the pit shooting. I'm interested to see if they will continue sort of that same type of arc as far as the season is concerned, because whenever you don't have other seasons to compare it to other than just the first season, I don't really know how they're going to structure the show, whether the last episode's always going to be this real high climactic kind of come to a head moment. And I think we are setting up for that, but I think it's going to be a little less of an intense episode to end the season as we get further and further into it, because we only have 10, 11, 12, 13, 14, 15, 6 episodes left in season 2, and it sounds like it's going to come to a head with Dr. Robby's sabbatical that he's going on. So he's still going on that bike ride for 3 months, and we had some really interesting conversation happen around this trip, especially in this episode, because of how many allusions we got to the bike ride and the different conversations that Robby is starting to have. Threw up some red flags for some people. So we'll talk about some of the speculation that's been going around on TikTok and online, and I just kind of want to get your guys' thoughts on what you think is happening with Dr. Robby. I think we've all gotten to this point where we believe that the trip is likely not going to happen. I think that we're all starting, everybody that I've seen talking about the show is kind of leaning towards the fact that there's just too many allusions to the biking accident that it probably isn't going to happen. And I think there were a couple of people that thought maybe Robby's leaving in episode 14 and he gets in a crash. I mean, I guess that could still happen, but I still think that we're more to the point of Robby having to confront the demons that hide in his closet, that he's not really taking care of himself. And we see that a lot with people who are dealing with trauma. And because he's having to be the leader that he has always been, he is more focused on how everybody else is doing. And a lot of times what you need to do is make sure that you are okay before others are okay. And I know that sounds selfish, but I always am in the belief of, can you really truly help others if you yourself you're not doing well? And so that's always, I think, something that is studied heavily in psychology, of the fact that can someone who is struggling with their own demons and PTSD and suffering through grief, can they really help others who are experiencing some of the same type of things? And I think it's good to have somebody that's going through, I guess, that similar type of experience, because you can sort of bounce ideas off of them, and you can, I guess, share notes almost in a way of how you are dealing with the grief. And I think that's what Robby is experiencing with everybody else that has gone through, especially last year when they had the shooting. But I do think that there are so many different things that individuals are dealing with, that it's not always the similar type of grief, and people don't experience grief and PTSD and trauma through similar types of outlets. And I think that people are um, dealing with things differently, and I think that that can become tough to try to compare your grief and your struggles and challenges with somebody else, because you guys are always dealing with things differently, or people are always dealing with things differently than others. So we got a heavy dose of that in this episode, and we have a really important line that I think really encompasses everything that we see in this episode. And I think it resonates so very true in life right now, and the experiences that people have in the emergency department and in hospitals. And that line is said by Santos. So we'll get into that first, because I want to use that line that comes up in a conversation between Robby and Dr. Santos. I want to use that as an ongoing theme. So we're going to jump into her story first. Now, we do pick up in the pit with Dr. Robby and team trying to get the chaos under control. And Robby says, all right, we all kind of need to stop what we're doing right now. And I know that it's busy. We're in code black. Westbridge is down. We don't have our technology, but we really do have to get this back under control, because things are starting to happen. And you see a lot of the fallout starting to really impact our patients here from the cyber attack at Westbridge, and the fact that the pit is having to shut down all systems in order to try to combat any type of cyber attack that might be headed their way, as they've not yet experienced one yet. But just to be safe, the CEO, remember, came down 2 episodes ago and said that we're going down, and we're going into more of a blackout, so that way we can try to avoid something happening. And Robby's just trying to get it all under control. He said, we need to address some of the challenges that you guys are having. So I need everybody that has challenges or questions, I need you all to raise your hands, and we can start to discuss some of the issues and answer any of the concerns that you might have. A bunch of people raise their hand. Dana tells Emma Nolan, the nurse that's been following her around, to take notes on all these things that people have questions about. And it is really interesting, because Dr. Robby, he answers questions from the pharmacist, which I believe is Dr. Nort, is how you say that. She has a question about drugs being prescribed and not fulfilling different needs that the patients might have. So he's like, of course, that's a challenge. We need people to be more direct and really understand that there's a process in getting the prescriptions signed off on, so that the pharmacist can give out those drugs that are needed. So that was answered pretty quickly. He's like, basically, we're gonna have to turn down more and more people, depending on the type of severity of the drug that is needed, and different things like that. So it's going to be tough. They have to make sacrifices, I think, in certain areas to try to get this all under control. Robby calls on Dr. Langdon. He calls on some of the nurses like Princess. He's talking, or Dr. McKay is talking, Dana's talking. But I found what was really interesting is that Dr. Javadi and Ogilvy have their hands up, and Robby basically says, your questions can wait. And I think this is really interesting. I think it shows that Robby understands that these questions maybe might not be as pertinent or as important, and that Javadi and Ogilvy, being more of student doctors, are not going to necessarily ask the questions that need to be asked. So he's asking in what appears to be seniority order. So he's asking people who, I mean, Langdon's question is probably going to rank higher than Ogilvy's and Javadi's. And because everybody has questions, everybody's raising their hands, Robby can only deal with so much before they have to get back to work. So I don't think this is a slight at all on Ogilvy or Javadi. I think it's more of Robby understanding the situation and knowing that if Langdon is having questions and McKay is having a question, and Mohan is or Whitaker are asking questions, Dana, Perla, or Princess, because they have been there so long, are asking questions, those are the ones that probably need to be answered before somebody like Javadi or Ogilvy. And you don't know, like, you don't want to ever suggest the fact that their questions are not as important because of their experience, because it could be very well, or it could very well be important to the situation. But I think Robbie is making the executive decision here to try to get to questions that he believes might be a little bit more important or hold a little bit of more weight. But uh, it really is just setting the episode up because some things start to fall through the cracks because of the different things that are happening at the nurses station and the organization of charts. And there's a conversation of the fact that patients are missing charts are being left at the bedside because everything's on paper, they're not being placed back into the files that they need to necessarily be put in. uh, you have certain CTs and MRIs and different things that are not getting back from imaging. And so that's a big problem because they can't really do anything or diagnose unless they have those images and what's going on with the patients. So that becomes an ongoing theme throughout the whole episode, and we really have a noticeable impact when it comes to a patient's chart and things getting lost in the mix. And so we'll talk a little bit about that once we get to that particular character. But like every other episode that we talk about with the Pit, we're going to try to focus character by character because it jumps around so much. And if we jump from scene to scene, it's going to be really confusing trying to connect back to different things that are happening throughout the episode. So we're going to jump in and start with a young patient that comes in. And this, I mean, it took a lot longer than I thought it would. Um, Getting a patient where uh, they have had experiences with fireworks. I know we got the older lady that I think that was, I forget exactly where she was, where she was from, but we got the lady that was talking to Dr. Rabinovich, and she had dropped like the really hot water and burned herself because kids were shooting off fireworks and they thought it was funny to play a little trick on the older lady, and it scared her and she dropped it. But this is the first real impact that we get from a holiday weekend with fireworks and the consequences of maybe playing with explosives, and which is always a it's a wild thing to me when, and I've always been terrified of actually setting off fireworks. I don't know if anybody out there is the same way. I know some people have no problems doing it, but they've always, I mean, it's just, I mean, it's so risky playing with them because you just never know what's going to happen. I mean, we've seen where fuses might be shortened, or where the firework goes off a lot quicker than you thought. And in this case, this is exactly what happened. So we get a 12-year-old Jude Augustine come in, and he is brought in through the ambulance bay with a hand wrapping on his non-dominant left hand, and he blew off two fingers with the firework. And well, what he claimed to be a firework. And so they are going to now have to deal with Jude's hand. And uh, again, a 12-year-old is going to be freaked out. Anybody would be with their hand blown off. It's going to be very painful, obviously, because I mean, your fingers, your hands, uh, any type of those things like the limbs and your fingers or toes, those are really sensitive to pain. So I can only imagine how that feels. So he's in a little bit of shock, but he's like, man, like I am in a lot of pain. And they're like, yeah, we'll get 25 a fent to your system so that way we can try to numb some of that pain. And they're going to continue to up that or increase the numbing through different methods. But they're going to open the bandage, and Jude, like any other person, is probably not keen to seeing what actually happened to his hand. So he's like, I don't want to look at it. And so Santos is like, you know what, just look at me and look me in the eyes and don't look at your hand, because we have to get this unwrapped to assess the situation and see what we're working with. So he and his friend had firecrackers. They were he had set them off, or his friends and them had set it off, and he was holding in his hand. And he said that he had noticed that he was running out of time, so he tried to let go of it. And right as he let go of it, it went off. And so it had, I guess you salvaged three of what they kept calling his most important fingers. You've got the middle finger, index finger, and then you've got the thumb, which, I mean, when you think about it, the pinky and then that fourth finger are not as important, especially on a non-dominant hand. So like you can still eat with the three fingers that you have with a fork, or grab utensils or write with those three hands. So that's really important to have those. And so they save those three fingers, but it does appear that he is going, and they asked the medic that came in with him, if they were able to grab the other two fingers, and he goes, no, they were blown to pieces. You couldn't have salvaged anything like that. So they're gonna do a sensory and motory type of test to see how much he can actually use the three fingers. And because the brain is controlling that, you're trying to see the coordination, the motor skills with it. Can you write? Can you try to, grab or clench something, just to see if they have if he has full usage. And he ultimately does, actually. So it's good in that sense. And so now they'll take saline solution to try to clean out anything that might be in there, or any kind of things that might cause an infection. But they don't really consult with Dr. Garcia, who is the surgeon in the ED that comes down quite often. And as we've gotten further and further into the season, I've started to like her a lot less and less, because I get her frustration, but she has been very combative, very confrontational. And I think she's becoming more aggressive. And again, this is not really, I'm trying not to knock surgeons too much, but there is a difference between surgical and medical. And one of my favorite shows, actually, it's currently being rebooted, is Scrubs. And I think Scrubs does a really nice job of explaining how surgeons think versus medical are looking to diagnose. They do tend to be a little bit better with patients as far as bedside manner. I wouldn't necessarily go to the extent of like surgeons are just meat cleavers, and they're just out there to just chop up meat and then sew you back together. I think it's a little more drastic in that show, or well, what was that show? As they're rebooting it, I think we're getting more sense of like surgeons are more dimensional than just being people that chop up things, like butchers. Um, Surgeons do, though. I do think they think of things more pragmatic, more of getting from point A to point B by doing what they know, and the methods that they know. And they're a little bit less concerned. And you can actually see it when she comes in to talk to Jude, because Jude's 12 years old. He just lost his two fingers. She approaches this as like a patient that's coming that's 35 years old and blown off his hand, and very like dry, very like, here's what we need to do. We need to get you to surgery. This kid's 12-year old. He doesn't, all he wants to know is if he's going to lose his life, and if his fingers that he's got left are going to be able to be saved. This kid is not thinking about everything that Garcia is wandering. And so I think and then we have different interactions with Garcia and Santos later. She just, and we had this in the past with some of our other patients, like Howard. She's a little bit less sensitive in that case. And I think I think she had to also care for the patient that came from the prison, and she wasn't really great with him. But the interactions that we've gotten from Dr. Garcia in this season have been pretty cold. And I think that she's played it extremely well, because I do feel like that is kind of the personality that she has taken on. So we'll see how the fallout of that all comes to a head, and see what her relationship is like with Santos, because it's a romantic relationship, and Santos sees her more of like a partner, whereas Garcia sees it more as a fling. And we get confirmation of that in this episode as well. But Jude is, of course, panicking, and they're going to have to call in a guardian, because naturally the kid's 12 years old, and they're trying to find a guardian to get in to talk to the doctors. And they asked Jude if he knows his parents' numbers, and he says, no, I don't know my parents' numbers, but I do know my sister's number by heart. And so he gives the number to the doctors, and they go in and they call his sister Chantel. And Chantel ends up coming into Edie, and we get a moment with her that I think is very powerful. And we've not gotten obviously to the conclusion of what is going to happen, maybe, but well, I mean, I guess maybe we have. I don't know. We'll see. But what ends up happening is they call in Dylan, who is our social worker. They come in and they are going to talk to Chantel about resources. But Dylan's job in any case with a child is to come in to basically eliminate any type of chance that there has been domestic abuse, spousal abuse in a kid situation. It would be more of sexual assault or sexual abuse. You would have the fact that like they're just trying to find out if they are in a home that is good for a child, and that can be so very objective. I think for I know that they're not supposed to be objective, but it would be very difficult to try to eliminate any kind of human element when being a social worker. So kudos to all of those social workers out there who have to do this on a regular basis, where you have to try to determine if the home is fit for the child. And there's so many factors that go into that, and the questions you have to ask are so very uh probing and invasive. And I think that it really does show in this episode of how difficult it can be for these social workers to try to navigate these situations. Because as a social worker, I would feel that you would have some sympathy slash empathy for different cases. And again, I know they try to be as objective as possible, but it's got to be so difficult because every human, it in some capacity is sympathetic or empathetic. Now, it might be very small, but I do feel like nobody truly lacks and has 0% empathy or sympathy. But again, some people argue that no, like people can have zero empathy for people, but there is definitely, if it's not empathy or sympathy, the conscience is always going to be something. I think that unless you're just completely um, incoherent or just your mind has been warped so much, I just feel like there's just some grain of empathetic feeling in people. So that's the way I believe, and that's why I think it would be so difficult to be a social worker, because a lot of times social workers are the biggest empaths, and because it's the work they've gotten into, and the reason they've gotten into that work is to help people. And so that's got to be challenging. And then you've also got physicians in here who are also trying to help people, and everybody has different emotions and feelings towards things. And we see that with Jude when when he's trying to communicate how much pain he's in. He gets to a point where he says, "I fucked up," and he gets really upset. Like the kid's really down on himself. So this kid's a good kid, you can tell. And before we get to that, there's actually a point when they're doing an assessment when Garcia's down there, where they're obviously going to need to perform surgery, but Santos calls Dr. Robby and Garcia over, and well, maybe, no, I think it's just Robby at the point. Um, and Santos says, "I smell alcohol on his breath." And Robbie's like, "Wait, what?" And she goes, "No, I think he's been drinking." So they run a blood test, and sure enough, I mean, he's his blood alcohol level is, I think, like a point 0.8 or something like that. Like it's really high. And so they won't be able to perform surgery until he's sober, and they'll have to get all that stuff out of his system. And so they're going to have to delay it, which is not good, because you want to operate on those types of things immediately, because you never know what you'll find once you get in there and try to sew up different things, and it could impact the other fingers the longer that you wait, and blood loss. And so you got to be concerned about what you can, and you can't really do anything medically when he is under the influence. So it's fascinating, and I think that it sets up it. That's why I felt it set up more. Like, are we going to get more about this kid and Chantel? But maybe not, because there is a point in the episode where we get sort of a conclusion on what Dylan, our social worker, is thinking. But Chantel is talking to the social worker Dylan in the room with Robby and Santos, and she's describing her situation, and she's not being very open. And Dylan's trying his best, or sorry, trying their best to open them up, Chantel up, and she's just giving one word answers, and she's just not giving a lot of clarity. And so they look at Robby, and they're kind of like, can you help out a little bit? Like, you've had the relationship, can you try to see if you can open her up a little bit? And Robby asked, and then finally, I think it's Santos that actually ends up opening her up. She goes, "Where are your parents?" And because she keeps alluding to the fact that her parents are not around, and they're like, "Did they die?" And she's like, "No, no, they're not dead. They went into an immigration appointment hearing, and when they did that 9 months ago, they were actually detained and then deported." So awful. Like, I think these people went in thinking they were going to go in for immigration status and then get citizen status, or at least a visa, and they end up going in for that. And then once they go through the process, they're actually detained and sent back to Haiti, where they're from. Which, again, this is very common, I believe, and something that is very, very relevant to our current social climate of immigrants being deported for with no cause, or any kind of justice for them, as they are trying to make their way to the U.S. to gain citizenship or work in the United States, and create a different life. And that's what they've tried to do with their kids. I mean, so what's really interesting to me is they've been here obviously for quite some time. Because they have been here for quite some time, maybe it is because they've not necessarily been here on a citizenship or maybe a visa, but it does sound like they were here, and rightfully so. They were supposed to be here, and maybe something happened where they were trying to extend a visa, or trying to apply for citizenship, but something fell through the cracks and they were then deported. Because the daughter is a sophomore, or was a sophomore, at Ithaca, which is a really great school, and had to then take a she then left Ithaca, and I think is attending Allegheny. I think she's at Allegheny Community College, which is not as good as Ithaca. And she was a sophomore, and that's when she had to move closer to her brother so she could then become what she calls herself, the surrogate mother to the child. And she goes, "It's a lot harder being the surrogate mother than it is being the older sister," which is why, like, think about that. You're 20 years old and you've got a 12-year-old brother, and or 11-year-old brother at the time, maybe, and you're given this kid, and now you have to become the parent at 20 years old. Like, that is insane. I mean, I don't think there's a lot of people in the world that are ready for a child at 20 years old, and she clearly wasn't. She had a life ahead of her, and she was it was a really interesting or not, I guess not a comparison, but a really interesting point that she brought up, where she said that my mom was so happy when I got into Ithaca now, and she was so very proud, and that was what she was just absolutely head over heels for at that point, that her daughter was doing so well. And now the biggest thing that her mother wants is just for her kid to finish high school. And so she goes from this very proud of her kid moment to just get by and try to do your best, because the kids were born in the US, so they're US citizens. And there is a conversation where Dylan sort of pokes at the fact that, like, have they ever considered sending Dylan to Haiti? And he goes, "No," or she was like, "No, there was never a thought of that," because he'd never been there. And I do wonder how much French he speaks, because I think that's what they're like. Haitians, I believe, speak French, but they she has the conversation with him in French, and but I don't know if he respond. Like, I'm trying to hold on. I want to make sure that I'm correct. That's the Haitian Creole. Yeah, so I think it's called Haitian Creole, actually. Haitian Creole, two official languages, Haitian Creole and French. I want to say it's Haitian Creole that she's speaking, but it could have been French. Either way, she was speaking in a different language to him. I don't know, it sounded more Haitian Creole now that I think about it. But uh, I don't think he responds in the language. I think he speaks in English back to her. So I do wonder, a lot of times what happens is, especially with kids that age, they're taught maybe to speak it, but they don't, or sorry, they're taught to understand it but not speak it or write it. And he could speak it, I don't know, but I think he does respond in English. So I do wonder how much he knows. So it would be weird taking him to Haiti where he doesn't speak Haitian Creole or French and has to then try to go and learn it at 12 years old, which would be very difficult to do. But back to what's going on, Dylan's like, "Can you leave us alone?" Because she starts to really break up, and Chantel does, and so Dylan's like, "Can you leave us alone?" And they then go to console Chantel, and then have more conversation about the resources. And then Dylan is now going through his type of exam that he'll have to go through to try to figure out if the home is fit to his standards of, like, not to his standard, but to the standards of what maybe social services would necessarily deem to be a fit home for a child. And so Robby and Santos leave, and that's where we get the line that I think truly uh, embodies what this whole episode is about. Like, I think you could use this as the running theme throughout this episode, because Robby talks about the fact that Santos goes, "Do we really need to get family services involved?" And Robby said, "You wanted to get them involved this morning when your 8-year-old patient, ITP patient, with your ITP patient." And Santos goes, "That's different. Abuse trumps neglect." And Robby goes, "We can't separate her." Or sorry, Santos goes, "We can't separate her from her brother. It's not right." And then Robbie's line that, again, I think can be used in every instance in this episode is, "A lot of what happens to people around here isn't right." I thought it was beautifully said, because in the hospital, in the ED, especially in a trauma center, a lot of what's going to happen in these people's lives, it's one of the worst days of their lives. So, or their family's worst day of their life. Um, the doctors, the nurses, and I think because of what Robby has experienced with COVID, with the passing of his mentor, with the Pitt shooting, with what he's experienced in this episode, this season with Langdon, he's just seen so much. And just think about going to work every day to experience this kind of trauma. And there is even a part in this episode where Dana and Emma are talking, and I promise this is all relevant. Dana says, "Hey kid, how you doing?" Like, she goes, I guess I haven't really caught up with you since we've had the sexual assault victim." She goes, "You did so well with her." And Emma's like, "No, I'm all right. Like, I'm doing all right." I think that she goes, "Is every day like this?" And Dana goes, "Well, take out the cyber attack, then yeah, this is a pretty normal day." And you can tell it really resonates with Emma, like, damn, like, this is a lot for people to try to do. And every day like this, and obviously it's not every single day you get a huge trauma, uh, but I would say for them, I mean, you're always dealing with somebody's trauma every day in the ED. So something bad is always happening daily in the emergency department. So there is no break. And especially especially for the clinical staff and the nurse, the nursing staff and the doctors, there's not really any downtime. I mean, you're constantly probably thinking about patients. And while a lot of times the ED patients might not be like, yes, you'll get your regulars, frequent flyers, but ED is the first stop in, sometimes the worst journey of people's lives. And you go through there, and then they'll send you to surgery, and then they'll send you to the PCU, ICU, and then discharge, rehab, whatever. I mean, so the ED is the start of many people's visit to a hospital. And so you don't really get to know them maybe as much as the floors upstairs, but you do, I think, probably connect with a lot of people in very dark times, because the ED is seeing all the trauma, all the people that will end up in the ICU. They're likely coming through the ED. So uh, the ED they're the first touch point, and so they get to know the patients first, and they get to experience the patients at their worst usually. because as they get further and further into their journey in the hospital, hopefully that is being, when they're in the ICU, hopefully that is getting, while it's still intensive care, at least they're in the next step of trying to get back to health. And so the ED, I mean, you're getting them right raw, like right when they experience whatever they've experienced. So uh, this has got to be tough for everybody involved. And the reason why I brought up Dana is the fact that she says that, this is a pretty normal day. Now you look back at what Santos has gone through and Robby are going through with this child, and just thinking about the weight that has, and that is what everybody has experienced. And I think that's why that line is so very good. And it really, I mean, this could be the motto for the ED: is a lot of what happens to people around here isn't right. So, uh, that's a really good moment. And then we get sort of a conclusion, I guess, maybe, just depending, I think, on what happens with Jude. But maybe this is the end because Dylan comes out after talking to Chantel. Santos and Robby are talking to them, and they say, for now, should be fine. He's fit to go back with Chantel. Chantel's a good parent, it's a good kid. Like, he doesn't see, or sorry, they don't see uh, a reason to place this kid into foster care based off of what they had found. Keep doing that. Um, but Dylan is basically like, we can send them both home when he's ready, but social services is going to have to make a visit. And social services, child services is likely to say that Jude is going to have to go to Haiti and live with his parents because they have seen many cases like this, and they said that this is pretty much how they have always experienced this type of thing, is that they feel that most of these cases end up sending the child to wherever the parents are, no matter what the situation is. So Santos is like, how can they do that? That's not fair. And Dylan's like, there's nothing really I can do about it. So it's out of their hands. And Santos doesn't really like that answer, but I mean, I think that's reality. I think that that's what a lot of times we see. So, so Santos and Robby, that's what they're dealing with. Obviously, we get other things that they're dealing with throughout the episode as well. Santos has a moment with Garcia where I think it's Garcia when they're taking. I can't remember if they're taking Jude up there for surgery, but Garcia is taking somebody for surgery, and as they're going to the elevator, uh, Santos catches up with Garcia and is like, "Are we still good for fireworks?" And Garcia is basically like, "No, like I'm pretty busy and stuff I'm gonna have to do, and because of the situation today, I just don't feel like doing that tonight, like going out with fireworks for you." And she goes, "And we're just keeping casual, so like no big deal, right?" And Santos gives like the, "Yeah, no big deal," but clearly Santos has true romantic feelings for Garcia, whereas Garcia sees this more as a fling and not really a real relationship. So that's a bummer for Santos, and I think that's she actually makes a reference to it. I think it's she is talking to Doctor, who was it? Was it Whitaker? She's talking to somebody. I can't remember exactly who she's talking to, but they're talking about dating. And Santos is like, yeah, better than trying to find love at work because that never happens. Basically, like, Garcia doesn't care about me like I care about her. And so we get a little bit of look into what Santos's romantic feelings are for Garcia, and that relationship is not going well. On to our next character. Dr. Mel King faces her biggest fear. And you can think of it as the deposition, but also her sister is sick, and her sister now shows up to the hospital. She finds out that her sister Becca has arrived at the ER, and she's as Mel, especially because Mel in this episode is now going to head off to her deposition. So I'm assuming in the next episode we're getting her actual deposition. But Mel is clearly flustered. She's treating the patient that came in last episode that was not able to see out of one of their eyes, and she is so distracted. And as the nurse Jessie is trying to do some exams, Jesse's like, hello, Mel, are you in there? Like, I need your help. And Mel is like, oh, sorry, I'm distracted. And she goes and performs a test. The patient with the clot, the blood clot in behind her eye, they'd given her the drug that had a pretty high chance or risk of death, which is wild, or losing complete eyesight in both eyes. It does appear that the medication is working to an extent and has unblocked some of that field of vision. So she is able to see a little bit better. And Mel's like, no, that's good. And but they are going to move her to the ICU to undergo further evaluation or observation. So the patient's like, "Wait, ICU? What do you mean?" And this is also the patient had a lot of questions, and because the medical field can be very translucent at times, not completely transparent, it can be difficult to try to navigate your healthcare journey because of all the terminology and things that just kind of go over a normal person's head because the way that it is explained in our healthcare system is just not very clear. So she's panicking when I mean anybody would if they go, we're going to admit you to the or the ICU. Like the ICU is the war. Like that's like, oh no, like there that could be death. And they're like, no, this is more of just so that you can get constant observation because the ICU is much more hands-on um, than maybe a PCU or just a normal unit. And so uh, they're going to move her to the ICU. I think we might have just a conclusion there with that patient. I don't know if we're going to get too much more on that, but Mel is clearly distracted. And then Becca arrives. And so I think this is Mel's worst fear is Becca uh, being sick. And so, as Mel is trying to prepare for that, her sister shows up, and now it's completely derailed Mel. Mel goes out into the waiting room, grabs Becca. She's like, "Hey, Becca, what's going on?" Becca's like, "Well, I've got a tummy ache," and Mel's like, "You know, this isn't a great time, but like, yeah, like I'll take care of you. What's going on?" And she, the, I think she lives in assisted living. The assisted living person had come with her, and she goes, "Was the I guess there was like there's a nurse usually on staff." Then they're like, "Well, no, the nurse wasn't available to see her, so they had to bring her to the ED." And Mel's like, "Okay, that's fine." So she goes, "I thank you so much." And Mel takes Becca back. And it's funny, Becca's walking through the ED, and the waiting room's like packed with all these sweaty people because it's hot in there. And she goes, "It's stinky, and all these people smell weird." It was so good, which was really enjoyable. And I love Becca so much. She's shown up on like FaceTimes and stuff, and she's always been really great in the show. But Mel has to go back, and she there's yeah, Mel goes back and she's trying to think about the fact that she has to deal with his deposition. She's nervous about that, but also trying to take care of Becca. She goes to explain to Robby that she'll have to go off the clock to go upstairs for her deposition. And then Becca's here, so she's trying to explain that. And she's going about 100 miles per hour. And Robbie's just like, hold on, calm down, Mel. Come over here. Like, breathe, breathe. You're fine. Everything's gonna be fine. Your deposition's gonna be fine. We'll take care of Becca while you're gone. Because Mel wants to take care of her, but Robbie's like, you know that that's a conflict event. Like you don't ever want to take care of a family member because you can't be objective the way you need to be. So we need you uh to chill, and we'll take care of it from here. So then he goes, we'll find somebody to care for her. Hold on. And he grabs Santos. Santos is like, I got too many patients. I'm gonna be so busy. I have to chart. Like you're putting too much on my table, or I'm sorry, on my plate. And Mel goes, no, not her. Like clearly, Santos is she's good with pediatrics. Like she's good with kids. Like she's good at empathizing with kids, and I think that's probably from trauma that she's experienced as a kid. So she's very good at kids. She is not great with bedside manner, and giving her an autistic patient, I'm not sure Santos would be necessarily the patient or the doc you would want to see if you were on the spectrum because I don't know. Santos is a little bit honest and rough around the edges, and I think it could be seen as kind of abrasive to those that are on the spectrum. So that was funny when Mel was like, "No, not her," and then Langdon comes around the corner, and Robbie says, "Okay, fine, Langdon, can you come and take care of Mel's daughter, or sorry, daughter, sister?" And Mel's like, "Oh, thank God! Like, I love Langdon. So she's like, yes, absolutely. Langdon can. So Langdon goes, yeah, don't worry about it. And so Mel and Langdon walk off. They go into Becca's room. Becca is sitting on the bed, and they're talking about her symptoms. And then Mel's like, I got to go. I got to go to the deposition. And Langdon goes, hey, listen, we'll be fine here. Like, everything's going to be fine. As Mel's trying to explain who Langdon is, Rebecca goes, Dr. Langdon, you have beautiful hair. So Mel and Becca both seem to be very smitten by Dr. Langdon, and everybody is. I think everybody loves Langdon except Robby. And so um, there is a point to, it's really cool, where Langdon back in season one had talked to Mel about sitting in the dark because people on the spectrum, especially in these types of situation, the less stimulus there is around, the less things that are the less you can make an environment stimulating for them, because it can be overstimulating, the better off it is. So Mel, I think, talks to Langdon at some point about how she and her sister prefer sitting in the dark when things get stressful, and like try to eliminate as much light and sound as possible. And Langdon remembers that. He does it with Mel later on, I think in season one, or after, like in season two, I think he does it with a patient on the spectrum. Now he's got another patient that he's taking care of that is also on the spectrum. And he remembers Mel saying that to him. So as Mel is going upstairs for the deposition with the lawyer who comes down to get her, Langdon says, hey, Mel, on the way out, can you turn the lights off? And she smiles because she's like, my daughter, or sorry, my sister's in really good hands. And so Langdon is great with Becca. He's asking, what's going on. And Becca's like, it hurts right here, like in my tummy. And it's more towards like the intestines, I think, is where she's pointing. And so I think Langdon's like, oh, okay. So I think I might know what's going on. So he starts to ask her about when she goes to the bathroom. And then he's like, is there like a burning sensation when you go to the bathroom? Or is there like this, when you go to the bathroom after you go, is there still like this feeling where you need to go again? And Rebecca is like, well, yeah, like that's exactly it. And Perla's in there with him, Langdon, and with Becca, and they're going to run some test urinary analysis, stuff like that. And I think what it's getting at is that Becca probably has UTI and has the feeling. And so Langdon explains it where he goes, is that a sensation you're feeling, is having to go again after you've already gone? And she goes, yeah, that's exactly right. And he goes, okay, well, he goes, that can be common in women, where they do get that sensation and then feel like they have to go pee again. And she goes, oh, so it's normal. And so I think Becca is trying to figure out, like, in her mind, she feels like, oh man, really bad things are happening to me and nobody knows, or is going to know what's going on. But Langdon clearly knows what's going on, and seems to have pinpointed exactly what it might be. And the fact that he makes it sound that is just, and it's a very normal thing to experience a UTI for men and women. And he's like, it's a totally normal symptom and a totally normal thing to have. Like, it's a total normal thing that a lot of people experience in their life, is a UTI. And he goes, we'll get you all fixed up and better. And you don't have to worry about it. It's pretty common. And that eases everything, all the anxiety that Becca has. It seems to really ease it. And you can see Perla is just like, man, he's so good at doing this. Like, you can tell Perla is approving of everything that Langdon, and the way that Langdon is speaking to her. And that's another theme throughout this whole thing, is that, and I've heard this multiple times through my wife or women that I know, where they go in and they see a male doctor who will sometimes, well, quite a bit often, actually, will, how would you say this? They would be not neglectful, but more of just like, no, you're not feeling any pain. Like, they're almost gaslighting female patients into pain that they're feeling. But as a male, you don't know everything that a female body goes through. So how would you know? Like, how would you know this pain and sensation? So again, I think it's done very well, and it's actually done well too. So let's jump to McKay, because this is very similar to a patient she is now caring for. There's a patient that McKay is seeing that comes in and presents with abdominal pain, pain in the intestines. She has PCOS, which I had to look up. I had no idea what that was, but they said it as if I should know what it is. And again, when terminology can be very confusing in the ER, unless you know that you have this, that if people start saying PCOS might be a possibility, I think everybody would be like, well, I don't know what that is. But it's polycystic ovary syndrome, a common hormonal disorder in women of reproductive age caused by an imbalance of reproductive hormones. It causes irregular periods, high androgen, which is a male hormone levels, leading to acne or excess hair growth and small harmless follicles in the ovaries or on the ovaries. It is a leading cause of infertility and can lead to long-term health issues like type 2 diabetes. So it attacks the ovary, uh and in this case, this is a patient that is or has been talking about the fact that she's been experiencing this. She, I believe, is an African American or female, and there's a point where she's talking and she says that I think it's Whitaker and McKay that are treating her, where she says it definitely is because she says something along to the effect of like, yeah, like uh, the healthcare system doesn't listen to women, and it was very poignant because it's very true. There has been many a cases where women's symptoms and what they're feeling has been dismissed by male doctors, and so I think that this was displayed very well in this episode, and especially in this case where McKay is trying to figure out what's going on. She knows that she has PCOS. The patient knows she has PCOS, so they know where to attack it. But the patient makes it a point to say that I have been in a multiple times where I've been in excruciating pain to different hospitals and different doctors, and I keep going to different EDs because I can't find anybody that takes my pain seriously. And McKay is very, as we know, probably the most empathetic on the whole staff. Like I would say McKay and Whitaker are probably the biggest empaths on the whole team. And so McKay is like, no, I'm listening. We're going to keep you here for observation. And Whitaker, because Whitaker at one point, not that he's being dismissive, but he says basically what the normal treatment for this situation would be. And McKay goes, no, I think it might actually be something bigger here. I think something might actually be worse than just the PCOS that she's like something's going on. And it's gotten to a level where the that syndrome has caused excruciating pain where they're going to have to remove one of the ovaries. And so it's a good thing McKay kept her around because they're going to have to do it because it could lead to very big long-term health complications and issues if McKay hadn't been so adamant about keeping that patient there. But the patient was so accurate in saying, one, as a female, a lot of times my symptoms and pain are dismissed by the healthcare system, but also I'm an African American female, and that has been a huge conversation over the last 10 to 20 years about women of color going in and being dismissed by the healthcare system because of a white doctor. And so they hit all sorts of great points right there of like, we need to be better as a society. We need to be better as a healthcare system. And that is one of the biggest challenges is health equity. And how do we get women who might be, or women of a population that might be underserved, such as the African American community, Hispanic community, whatever it might be. We need to be better as a society to be able to provide healthcare to people that is affordable and we can take care of anyone. And that's just not where we are as a healthcare system. So that was a great moment. It was a good example of what we truly and what women truly experience when we talk about healthcare. So McKay, again, fantastic. She then has the other patient that she has been treating, which is our patient Roxy, who has been in pretty much the whole show, I think, so far this season. I think there's only been like an episode or two where she's not been in it. But Roxy is, remember, the kids came in for the ice cream party. Now Roxy's parents have shown up. Her husband's been there. The death doula has been there. And Roxy is just. Really just feels that she is a burden on everybody's life. And now I think she even feels that way when she talks to McKay. I think she feels like, "Oh, I'm just burdening you too. Like you need to do other work and treat other patients, and I'm just here dying, and there's nothing anybody can do about it but make me as comfortable as possible." And that's what hospice is. And she's been suffering for months now. I think a lot of times this happens with hospice patients where they're at end of life, and sometimes people enter hospice and are there for months and months, maybe years, in hospice care, just depending, because the disease and cancer, it doesn't have a timeline. It's going to do what it needs to do, and it doesn't care about timing or when, or sometimes it elongates, and it's a problem for years. And I think you get to a certain point, much like Roxy is, where she has felt she is a burden to her family. She doesn't want her kids to remember mom as always being somebody that was just in pain and suffering all the time, which would be just awful mentally for the kids that are what appear to be 12 and maybe 10, so younger kids. And so you can tell that the oldest is having a very difficult time with this because he doesn't quite understand why this is happening, but he's now old enough and mature enough to understand that this is happening. Where the younger one, I think, just thinks, well, mom's still here, and I know she's in pain, but she's still here and she's still mom. So he's younger. He might be 8. And so you can tell he really doesn't comprehend what's actually happening, whereas the oldest does. And then her parents are both fantastic with the kids. The husband is, I mean, that kind of husband that is stuck by her side, uh, for as many years as she's had lung cancer. He has been there for her, and I think that's been very difficult for him to go through that experience and process with her. So nobody wants to see anybody in pain, especially your loved one and spouse or wife or kid, especially. So you can tell that the husband is trying to cope best they can. But we get to a scene where, and throughout the episode, it shows that they're still there. They're still there, and I think that they're doing that to show that the family had been there a while. And then we get a scene where McKay goes in, she looks in through the window, and all she can see is Roxy's feet, and Roxy's feet aren't moving. I do think that there's a little bit of the reason why I think that they do it, they show the way that McKay is entering the room. I do think that there is a point where McKay is thinking, I could walk in here and she's no longer alive. And you can tell McKay really cares about her. And so, because McKay relates, McKay has this, I think, a kid or two that are similar ages to her boys, Roxy's boys. So I think McKay can see herself, not necessarily that she's dealing with cancer, but like that could be me in the bed. And so McKay's having to go through that. And that is something like, and here is something that we talked about earlier in the episode, where sometimes the ED is very fast paced, and they move patients as fast as possible. But sometimes you do get those patients that are not lingering, but are still there because of the things that they're going through. And we're pretty much to the point where Roxy, we're kind of just waiting for her to pass. And in the last episode or two, no, 2 episodes ago, I think it was, where Robby said that there's this double consequence type of thing. I forget exactly what he said, but it's basically you give her enough morphine to where she's either not feeling as much pain, but there's also the consequence or risk of her getting too much of that, and she would ultimately pass because she couldn't breathe because of the drugs. So it's basically, I mean, it's almost like they're describing euthanasia, which is not legal in the U.S. So it's so tough because when you're in that much pain and suffering, and Roxy clearly has given up on the fact, and so she's just like, I just want to die, and this is not allow life is not allowing me to end. So it is such a deep conversation that McKay has with Roxy. And Roxy does. She's like, I just am so tired of being a burden to my family. I just want to move on so they can move on. And until I move on, they're not moving on. So these people are just dwelling in my death. And I think that is something that's so important to understand in healthcare. And I think that that healthcare workers do know this, but I think that there is sometimes where it's not in front of mind, the fact that you're not just caring for the person in the bed, you're caring for the people beyond the bed rails, right? The family as well. And so you got to keep uh, the way that they're experiencing these things and their trauma in mind as well as you're treating them, because you're interacting probably with the patient's family more than you are the patient at times. So again, I think that is something that McKay does so very well, and she steals this episode. I thought Fiona was the best in this episode as Dr. McKay. Thought she did a phenomenal job, which she usually does. I always like when we get more of her stories because hers always seem to be so very deep into what she's dealing with, and a lot of what she sees is self-reflective in her patients. So that was a really powerful scene of McKay saying it's okay, everything's going to be fine, and when you pass, I think your boys will know just how much you meant to them, and that they're not just going to see a mother that was always in pain and suffering. So that was very powerful. I thought. Who else can we dive into? Santos is also dealing. I forgot about this one. Santos is also treating a patient that she is a furry, and she was at a convention of furries, and she's describing the community and how the community can be seen as from outsiders as weird. But I mean, furry, just like anything else, like cosplay or any like. I don't know why we are so quick to judge people for their whatever they want to do with their lives. Like, who cares? Like, let people live their lives however they want to live them. I'm not judging you on how you live your life. Like, do you? Doesn't impact me. Like, I love when people can embrace whatever they want to do and love it, and whatever hobby you might have or whatever lifestyle you might have. As long as you love it, who cares, right? So that was a cool moment. She has a really good moment. Santos again, very rough around the edges. You can tell she has a little bit of judgment when she notices that this patient is a furry, but I think as time goes on, she's like, oh, this person's just like me. So who cares what they do in their free time? Like, it's their life. Let them do what they want. But it's a really interesting moment because I think Santos is getting barriers breaking down. I think that's what we're really getting into with her, is that the more she gets into it, the better she is becoming with people, even though she's very stressed out. Really interesting note. The actress that plays Dr. Santos, Issa Briones, she put on Instagram that she had been dealing with appendicitis during this episode when she was filming. So that's wild. She had to have an appendectomy after this because of all the pain. So that was crazy that she was able to put on quite a performance with the pain that she was going through. All right, let's talk about Dana. Dana has a little bit here. She actually calls in a really good friend, and I gotta remember what her name is because things are really hectic in the ED as usual, especially on Code Black. But throughout the episode, somebody kept saying, like, "Are you getting your help that you need? Are you getting the help that you need?" With Dana, and Dana's like, "Yeah, it's coming." And then we get introduced to a character. Here it is. Sorry, I got it on the screen over here to the side. I guess I could have just scrolled down here on my IMDb page. Monica Peters is called in, and she is played by Rusty Schwimmer, and Monica Peters is a former retired clerk. So this is a person that sits at the nurse's station that does non-clinical operational directional type of thing work. Usually you have like a huck or a patient tech or a nurse sitting at the nurse station trying to navigate the waters as far as our operations are concerned. Some hospitals do have a position that Monica Peters is that is this clerk type of work where it's very clerical, where it's very run labs here, run labs there, but basically a charge nurse that is not dealing with necessarily the clinical side of things. But she gets called in for extra help. Like, this is a clerk that has, she says, Dana introduces her as being retired to Al Hashimi. Al Hashimi says, it's nice to have you here. Thanks for coming in to help on your retirement. And she goes, well, I didn't really retire. I got pushed out by technology and the robots, which is fascinating because she says it to Al Hashimi, who has been very pro AI. And so she says it to the one person that would probably really like, no, we need AI. And Monica would be like, no, AI took my job. So a very real situation that we are experiencing in real time in 2026. So we get her in, she runs this thing like I mean, just old school, very like, you need to run the labs here. She asked one of the people that come down, I think it's one of the, I think she's probably in quality or case management, but she's like, uh, "Are you in good shape? Do you run a lot?" And she goes, "Well, I mean, I run marathons and 5Ks." She says, "Good. Run these labs up to the lab and get these things done in 15 minutes, and then come back here in 15 minutes, check in, and I'll get you to run some more blood samples and things up to the lab." She is like drill sergeant. I mean, this is she it's even funnier because there are two nurses running kind of like the clerical side of things, like they're acting as the clerks. She goes, "Are you two clerks?" And they're like, "No, we're actually nurses." And she goes, "Well, then why the hell are you sitting in my spot?" It was so good. She's like, get out of my face." Like, go do what you know how to do best, and I'll do what I do best. So that was a solid. I mean, it was like Dana 2.0. Like, it was so solid. And I hope Monica's around like a little bit more. I loved her. I thought she was great in this episode. And I think it's very fitting because they don't really have a clerk or anybody that really sits in that spot that's got a real good presence yet. So maybe they bring her out of retirement. That'd be a lot of fun if she's in seasons to come because she was great. I thought that Rusty played this so well. I thought she was phenomenal. But uh, the reason why she gets called in is things start to really fall through the cracks. We get Javati, who is really up to her ears in all sorts of expectations. She's been called a Nepo baby by Garcia at this point, um, where she's really slipping. And I think the conversations that she's had with her father, who introduced her to a dermatologist, the pressure from her mother, who is a legendary doctor and physician, I think you're really starting to see Javati consider life outside of the ED because in this episode, we see for the very first time because she's very intelligent, but I think the confidence is really starting to wane because Ogilvy seems to handle things a little bit better than she does when under pressure. She has the competition with Ogilvy. Kwan is very good at what she does, and Kwan knows what she wants, but Javati doesn't really know what she wants. And I think the pressure from her father and her mother, the expectations and the shoes she thinks she has to fill of her mother's, where the father seems to be a little bit more laissez-faire, where he's just like, "Do what you want to do, kiddo. I'm proud of you no matter what." Mother is much more of like, "No, you need to do this because women do this." Uh, Very, very conservative mother, and I think it's really waning on Javati, and Javati starts to make mistakes. She puts a patient in a room and forgets to write it on the board because the digital board's down. They have a whiteboard board that she should be inserting the patient information, but because they don't, room 12 is already occupied by a patient that comes in with intestinal pain. And because Javati forgets to write it down, the nurses don't know to cover it, which again, you have to write things down. Javati tries to blame it on the nursing staff. And Dana's like, "Hold up. No, no, you're not going to do that. Everybody needs to pitch in." Because Javati's like, "Well, the nurses should be the ones that writing or that are writing this down." And she goes, "No, no, no, don't put that on my nursing staff." Like, Dana steps up and really defends the nurses here, which you can see that sometimes between physicians and nursing, where they'll hit heads because they uh, they do have so many things that they do that both of them can do to take care of a patient, but the physicians always feel like maybe it's beneath them to do it, so the nurses need to do it, and the nurse is like, "Whoa, whoa, whoa, you can do that too." So you kind of see that leak in here, and Javati gets kind of reamed by Dana, and she's like, "Oh, my bad." So then Javati's able to insert the information, but as she goes to check on that patient she put in room 12, um, that patient is unconscious, and they forgot to plug in the monitor, like set her up to the monitor, so it's not showing a heartbeat. So Whitaker comes flying in. Whitaker's like, she's barely breathing. They get a crash cart over. Robby comes over. He's like, "Javati, what's going on? Tell us the story." Javati's like so frazzled and confused that she doesn't know what's going on, so she doesn't say anything. And he's like, "Javati, hello." And you can't crack under pressure, not in the ED. You got to get something together. Whitaker's like, "Fine, I'll jump in, I'll do it." And he does it. And then there's like an intubation type of intubation that he's doing that he hadn't quite done before. And he said that usually I have a video to show me how this is done, because there are so many times where the video comes up and they're actually teaching you as you're getting ready to do the thing. And Robby's like, nope, you're just gonna do this out of the video. I'll walk you through it. And Whitaker's successful when he does. They get a pulse back, but Javadi completely cracks under pressure. She gets deer in headlights. And we've not really seen her do that because she is the prodigy. We haven't really seen her get frazzled, but she finally has succumbed to all that pressure and has really started to unravel in this episode and almost kills a patient. I mean, this patient almost dies because of it. And she tells Whitaker this later, where she's like, I almost killed that person because I did not pay attention and I got wrapped up in things that I shouldn't have. And Whitaker's like, we make mistakes. Like, that's going to happen. Things are going to fall through the cracks, especially during a cyber attack where the, technology that's used to aiding you is not around to help you. Things are going to happen. And Whitaker, very good at teaching. I mean, he's very good. And because he's now presented, it was pretty cool. He was now presented, I think now he's a resident. So he's presented his MD badge. So he's got like the Dr. Whitaker, and Robby calls him Dr. Whitaker at one point. He goes, no, just call me Whitaker. But Robby's like, no, you've earned to be called Dr. Whitaker. And so, yeah, I mean, Whitaker's so good at teaching, and he's so good with people. And I think he's made enough mistakes where he knows, like, yeah, people make mistakes, like things happen. Patients are going to die. He's like, patients will die on you. And if you are in this line, if you are in this department, you got to get used to the fact that people will die on your hands, and you got to be able to move past that. And there's a lot of doctors that can't do that. And I think that's where she's really starting to maybe say, maybe the ED isn't for me. So it'll be interesting to see what her journey is, because she did really crack under pressure in the ED. And that's not really somewhere you can afford to crack under pressure and then feel bad about the fact that it might have killed a patient, because you're going to kill a lot of patients as doctors, and you're going to have to deal with that. And not that you're meaning to kill them, but people are going to die. All right, people will die. You're a doctor, and you've got to be able to work through that. And if you let every patient's death impact you, then you're eventually going to not be a doctor anymore. So it was a really good scene. Whitaker's great in this. Speaking of Whitaker, he and Robby, when I said that he gets his MD badge and is congratulated by Robby, that is when Whitaker is on his lunch or in the break room, and Robby comes in to talk to him. And this is where we really start this conversation. We're going to try to wrap this up. I know this is a little bit of a longer episode, but a lot of things happen. But we're getting a sense of Dr. Robby is passing off different things. Robby talks to Abbott at one point, and but it's all kind of centered around this idea where Robby is going on this trip, and now it's been alluded to multiple times where Robby says, if I don't come back or if I don't return, then you'll have a sweet bachelor pad, because he offers for Whitaker to house sit while Robby is on his 3-month sabbatical, because Whitaker's having issues with Dr. Santos because they're roommates, and Whitaker wants out, and he's like, oh, thank God, that'd be great. And we learned that Whitaker is still taking care of a patient that he dealt with or had taken care of, where she has a baby. Maybe Whitaker has some feelings for her, but he's been like working on her farm or something like that. And Robby's like, you've got to have boundaries, because if you don't, what you will do is you run yourself into the ground, because something's going to happen to that person outside of the hospital that you can't handle. But if you get too close with your patients, the patients are going to let you down. And then because you don't have any boundaries, bad things are going to happen to you or that patient. So he's just telling Whitaker he needs to set better boundaries, and doesn't need to befriend every single one of his patients, because it's ultimately going to hurt you in the long run when one of these patients die or betray you or whatever it might be. And Whitaker's kind of like, yeah, no, I get that. But then he's offered to house sit, and Whitaker's like, yeah, I'll take you up on that. Definitely. I want to get away from Santos and the craziness that she's got going on, because they are clearly driving each other nuts. So Whitaker's going to house sit, but he tells Whitaker, if I don't come back, you get a swanky new bachelor pad, which I found very weird that Robby would say that. And then he says a similar thing to Dr. Abbott and Dana, where it's like, if I don't come back. The one with Abbott really was interesting, because Abbott says, if you get so dark and you get into your mind so much and you get to a bad place, you need to call me. So I'm starting to think that maybe Robby at some point has had suicidal thoughts or very depressive thoughts. And there has been a lot of conversation online is the fact that like there has been multiple people say that they are physicians where they've dealt with something like this where they've had colleagues that have said they're going on sabbaticals and then end up like taking their lives. So I don't know if it's that to that extent. That would be an extreme, but I do get the sense of the fact that like Robby doesn't plan on coming back. I think it finally has taken so much of a toll that Robby doesn't plan on coming back. I don't think it's suicide, but I do think it is he does not plan on coming back at all to the pit or to being a doctor. I think he's done. Like I think he's gotten maybe he'll be doctor without borders kind of thing where he's dealing with more mild cases, but I think he's pretty much done doing what he is doing in the pit. I think he's trying to find his way out and that the 3 months would turn into an eternity because he would never come back. He's trying to get away from everybody. He's trying to distance himself. And now it's starting to make sense. He's a little bit more distant with everybody's interacted with, and he's kept Langdon at arm's length since his return. So I do wonder what kind of emotions we're getting into with Dr. Robby and really what's going to happen because I do feel like that motorcycle trip wasn't just a motorcycle trip. That trip was a I'm trying to find out who I am, and I believe that I am no longer the Dr. Robby that will serve as an ER doctor at the pit anymore. So more to come on that, but that's ultimately that's all we really get with Robby in this episode is the fact that he is dealing with this darkness that is over him. One more patient that we want to talk about, Howard. So we do see a little bit of Dr. Abbott, but I figured we wouldn't get a whole lot of Dr. Abbott because he was the one directing this episode. Sean was, and we get a return of Howard, one of our favorite patients from last episode, and Dr. Abbott is like, we got to get you up to surgery. Garcia's like, we can't wait anymore. If we don't do what we need to do, it's 100% of you dying. If we do the surgery and we do remove what you need to be removed, there's a 50% chance of you dying. So either way, there's a high chance of you dying. Just depends on which one you're going to take. And he takes the more risky route of like he was almost the fact that like fine, like I'll just take the risk of dying. And she goes, no, like we really need to do surgery now or you will die. So they end up calling his sister. They get a hold of his sister. They FaceTime because remember, he had kind of isolated himself after his parents' death, I think it was. And his sister talks about her son and like he's going on his first date. I think it's like prom or something. And you would be so proud, Howard. And Howard's like, oh, he's just like me, getting the ladies. And she kind of laughs at that. And she goes, I miss you. I really do. And I'm sorry that this has happened. I'm sorry that we let it get this bad. And you need to take care of yourself. And Howard's like, yeah, no, I know. And she goes, okay, we're going to set up a time, come to Arizona after you're done, and you can hang out with your nephew. And he goes, I'd really like that. And she goes, I love you. And it was so good. I mean, we got a reconciliation here, and it looks like Howard's going to, I just hope, no, I don't hope Howard doesn't die. But it was such a cool moment. They had to go outside to get internet service because remember, all this stuff's down. So they had to roll him out into like the ambulance bay to get service to FaceTime. And they're like, we need to go. We need to get him upstairs. And the sister's like, no, I understand. Get him up there. Get that surgery done. Hopefully we'll see Howard on the other side. Powerful moment, that one. Just some other things to mention that happened in the episode. Ogilvy, I think we're headed for kind of an Ogilvy arc here. There's a patient that comes in that was dealing with kidney stones. Ogilvy's like, have you ever had kidney stones before? Because the patient had said, I got another kidney stone. And Ogilvy goes, have you ever had kidney stones? He goes, yes, that's why I said another. Hence the fact that it means an additional or one that I've had a like occurrence and it's happened again. That's why I said another. Guy goes, sorry for being an ass. I'm an English teacher, high school English teacher. To which Ogilvy goes, yeah, my dad, I understand. My dad's a high school English teacher as well. And the patient then goes, oh, well, he must be proud of you for becoming a doctor. And he goes, I don't know, you'll have to ask him. So Ogilvy, parent problems, daddy issues. Like he doesn't talk to his dad. I think this guy reminds him of his dad. So I think we might get some interesting, because then they're like, well, maybe it's not kidney stones. I think this might be something else with your kidneys. I think we're about to get like a deep Ogilvy storyline here. I think we're going to finally understand why this kid's an asshole. Like, I really do. I think we're setting up, we're going to get some answers as to why Ogilvy is the way that he is. He's very good at what he does, but he's very rude about what he does. We also had the imaging radiology guy come down. That was funny. That added like a new element. So he brings down like a mobile imaging type of machine where he can look through scans and images of like x-rays and stuff like that to identify there, so that way he can communicate and they don't have to have runners go back and forth to communicate things. And he doesn't, he can sit at this machine and tell people what's wrong. But that's the guy is very attractive. And so the nurses, especially Princess, is really distracted by what he does. There was one point where Quan is like, here's what I noticed, and he's like, you're so good at that, how did you get so good at it? She goes, I'm good at everything. And the radiologist kind of goes, oh cool, that's funny. And then she walks away and Princess goes, I'm also good at things. And the guy's like, what? So, and that was a good one. The radiologist, I'm sure that was just a fun little to have some a little bit of comedic relief, but also to show that like sometimes radiology and all of them imaging and all, they all have to jump in and help where they can help as well. And it was a very crowded nurses station with that big imaging thing there, so it was showing kind of the spacing. Then Donnie is walking out, our patient that is a furry, and he goes out in the lobby, and there is breaking news on the TV. This is where our episode ends. Breaking news that a structural collapse at a water park, a water slide collapsed, and there are patients, one deceased, but there are two patients, I think, coming in. And from this collapse, being airlifted to the nearest trauma center, which will be the Pitt. So that is where our episode ends. We are going to get first responders bringing in those patients from the water park collapse. So that'll be wild. And if you've seen the preview, you know it's a father and a son that are being brought in. So we're gonna get into heavy stuff, I feel like, in this next episode, because we'll be at episode 10. We'll only have 6 episodes left of the Pit this season. So we're really going to start to get into some heavy hitting episodes, which these have all been great. This was another solid episode. I'd give it a 9 out of 10. I really enjoyed this episode a lot, and we're picking up a lot of steam. So I'm really looking forward to seeing what this next one's going to be with the water slide, just because I feel like it's going to be very heavy. We got a father and son coming in, and from the looks of it, from the preview, it doesn't look good. So we shall see what happens. But yeah, looking forward to it. Thanks for listening. Thanks for watching. If you're over on YouTube, you can like, subscribe, comment, helps people find the show. Over on Apple Podcasts or Spotify, anywhere you get your podcast, make sure to like, subscribe, rate, whatever you do on the podcast to help people find us. Socials, the Screen Society Podcast. If you just search that, you will find us. We've got different usernames, and I'll try to drop those down in the show notes. But again, thanks for listening. Thanks for watching. We'll see you next time when we talk about season 2, episode 10 of The Pit, titled 4 p.m.